Nervous system. Now, nervous system of our body can be divided into central nervous system and peripheral nervous system. Okay. Now, central nervous system, it consists of brain and spinal cord, right? And the peripheral nervous system, it consists of the cranial nerves and the spinal nerves. Cranial nerves mainly exists from the brainstem and spinal nerves from the spinal cord. One extra nervous system, part of the nervous system is present, that is known as autonomic nervous system. Now, this autonomic nervous system consists of sympathetic part and parasympathetic part. Sympathetic and the parasympathetic, they are part of autonomic nervous system. Coming to the brain. Now, brain. This brain, it consists of several parts like cerebral hemisphere. Number 2, cerebellar hemispheres. Means these two means cerebrum, cerebellum. Each cerebrum consists of 2 cerebral hemispheres and each cerebellum consists of 2 cerebellar hemispheres. So we have 2 parts of the brain. Along with that, number 3, we have brainstem. Now, brainstem, it consists of midbrain, pons and medulla oblongata. Medulla oblongata. Midbrain, pons and medulla oblongata forms the brainstem, and this medulla oblongata continuous below the foramen of magnum as the spinal cord. Okay. Now, coming to the spinal cord. Spinal cord is a tubular structure which is about 45 centimeter in length. It is present in the vertebral canal. It extends from the first cervical vertebra to lower border of the L1's vertebra, means first lumbar vertebra, in case of adult. In case of child or below 1 year of age, that is known as infant, it extends up to the lower border of L3. Now, coming to the coverings of the brain and the spinal cord. Coverings. Brain and the spinal cord is covered by meninges. Meninges has got 3 layers. From outside inward, they are dura mater, arachnoid mater and pia mater. Okay. In case of brain, it is covered by dura mater, which has got 2 layers. One is endosteal dura and another is meningeal dura. Right? But in case of spinal cord, the dura mater has got only one layer, that is meningeal dura. Do not have this endosteal dura part. Okay. Now coming to the look, this is, if this is the spinal cord, the last end of the spinal cord, it ends like this nib-like, cone-like structure. This is known as conus medullaris. Now that ends at the level of L1. Now from each segment of the spinal cord, one pair of the spinal nerves exits. Now spinal cord has got 21 segments. So 21 pair of spinal nerves exits through the tubular structure, tubular part of the spinal cord. Rest of the spinal nerves, as because we know we have 31 pairs of the spinal nerves. So rest of the 10 pairs of the spinal nerve, they exits as a bunch from the lower end of the spinal cord, or that is conus medullaris. This bunch of the spinal nerves, known as, just looks like a tail of a horse, so it is known as cauda equina. And the pia mater, which covers the external surface of the spinal cord, from that one extension of the pia mater is related to the central part of the cauda equina. This thread-like structure is known as phylum terminale. Phylum terminale. Okay, so phylum terminale is nothing but a fold of pia mater that is related to the cauda equina, bunch of nerves, last 10 pairs of the spinal nerves. That's it. Now so this is about the spinal cord. Now what are the cranial nerves we know? Cranial nerves, how many cranial nerves we have? Cranial nerves, they are 12. Key cranial nerves. What are the cranial nerves we have? Optic, that is the second cranial nerve. The first cranial nerve is olfactory. Olfactory nerve, it is related to the olfaction, means smell. Optic nerve, it is related to vision. Then oculomotor. Oculomotor means it is motor to the ocular muscles, means muscles of the eye is related to the third nerve, that is oculomotor. Fourth nerve is known as trochlear. This is also related to third, fourth, or they are related to the eye, muscles of the eye mainly. Okay. Fifth one is trigeminal nerve. This trigeminal nerve, fifth nerve, it has got three divisions. One is ophthalmic division of the trigeminal nerve, sensory to the eye. Then maxillary division of the trigeminal nerve, and then we have mandibular division of the trigeminal nerve. This maxillary and mandibular, they have got both motor part and sensory part, and the ophthalmic is totally sensory. Okay. Sixth nerve is known as abducent nerve. Abducent nerve. Now these third, fourth and sixth cranial nerves. They are related to eye and eyeball. Seventh nerve is known as facial nerve, related to the muscles of face, and eighth nerve muscles. Then eighth, that is vestibulocochlear nerve, related to the hearing. 9, 10th, ninth nerve is glossopharyngeal nerve. Now this glosso means tongue, pharyngeal means related to the pharynx, means tongue, and pharynx, the muscles are supplied by this nerve. Then we have the vagus nerve. It is both motor and sensory. And then we have cranial accessory. Cranial accessory nerve. And then we have hypoglossal nerve. Hypoglossal nerve is again glossus, means it is related to the tongue. Cranial accessory mainly related to the neck muscles. Neck muscles are supplied by the cranial accessory, and also this cranial accessory supplies some muscles of the soft palate, muscles of the pharynx, also supplied from the cranial part of the accessory nerve. So these are 12 cranial nerves in our body. So optic, olfactory, optic, oculomotor, trochlear, trigeminal, abducens, facial, vestibulocochlear, glossopharyngeal, vagus, cranial accessory, and hypoglossal. This much you have to know about the nervous system.